Hello and welcome to Unit 3 of the module on disease outbreak response. In this third unit, we'll be looking at the incident management system. An IMS, incident management system, is an emergency management structure and a set of protocols used to guide and coordinate the actions of various entities which respond to and mitigate the effects of all emergency types. These entities may include government agencies, the private sector, non-governmental organizations, and other actors. So also known as the Incident Command System, ICS. IMS is the approach to emergency management that many countries and organizations have adopted. IMS is a common organizational model that can be applied to outbreaks and all other hazards and emergencies. It brings together different teams, their expertise and resources to manage the emergency. IMS can be applied to all levels of emergency management and management responsibility within a particular jurisdiction, from national governments to frontline emergency response services. IMS provides a standardized approach to response management. It is modular, scalable, and adaptable. And so IMS has standardized components that are flexible as the organizational structure expands or reduces in size to address changing requirements. And the IMS structure is adaptable to changes in demand without the need for reconfiguration of its basic structure. So the operational structure of the Public Health Emergency Operations Center is designed to support the incident management system. And the incident management system is based on 5 core functions. And these are incident management or incident command, operations, planning, finance and administration, and logistics. So these core functions expand and contract to the size, scope, and complexity needed to appropriately support an emergency response. So this flexibility is supported with the staff mobilization process, which brings in the necessary number of people with the right skills and experience to work on a response in a timely manner. And so during an outbreak response, surge capacity is the ability to draw on additional resources to sustain operations and increase capability. So here we see the pictorial representation of those 5 core functions of the IMS, and the incident management, which is responsible for overall management of the response. Operations provides a sense and providing direct response at the field level. Finance and administration, that manages finances and tracks materials and human resources. And then planning has to do with collecting and analyzing data. And logistics, that is responsible for acquiring and managing, tracking physical resources. So the incidents management function, let's look at the first core function, which is incident management and its activities. So the incident management function is responsible for overall operations of the Public Health Emergency Operations Center. It carried out determining the coordination of responses, the response activities and partners, liaison with other agencies, public communication, staff safety, health and welfare, situation reporting, resource mobilization. These are all functions of incident management. And to do this effectively, the management function will need to understand the roles of all the other responding organizations and the wider context of the response. The incident manager and management function key roles include the incident manager or the incident commander, who is normally appointed from the responsible or lead agency in charge of the response. And the Public Health Emergency Operations Center facility manager, who is responsible for the functionality of the Public Health Emergency Operations Center, including operations and maintenance of the facility. And we also have the Public Communications Officer, who develops and delivers communications products and advocates for the response. There's also the Safety or Security Officer, who is responsible for ensuring the health and welfare of the response personnel, and the Liaison Officer, who maintains links with responding partner organizations to ensure they are able to share their expertise as part of the response. So within the management function, these key roles should be identified as soon as possible or in advance if feasible. Yeah, so move over to the next function, which is the operations function. And like we said before, we're responsible for using resources to respond directly to the event. And there are key activities, and the operations can be grouped based on the nature of the event. For example, prevention and control measures, such as vaccination, contact tracing, triage, and so on. Another category of the activities could be health service delivery and health intervention, such as treatment and transportation of the sick, and decontamination and establishing emergency clinics. Another category is training of health staff to acquire specific knowledge and skill needed for the response. There's also risk communication and community engagement, including scaling up community outreach for health promotion and case management. Next is the planning function. And the planning function both on site at the tactical level and at the operational and strategic levels. So planning activities will concentrate on mapping of capacity and functionality of resources and planning for addressing the events. And this requires aggregating and processing data, developing and communicating operational information, predicting the probable evolution of events, and developing objective strategies and action plans, and identifying the technical expertise that is needed to carry out the response effectively. Next is the logistics function. Essential actions for the logistics section during the response phase include supporting response to incidents by establishing functional offices, housing and storage facilities, and providing telecommunications and other equipment at both national and subnational levels, and managing delivery of services by ensuring the transport, customs clearance, delivery, storage, and management of material assets for the response, and then as well anticipating ongoing sustainment needs and providing advice about logistics and to inform planning and operations. Next is the finance and administration function, which is responsible for tracking expenditure and other forms of financial transactions. The key activities include cash flow management, budget preparation and monitoring, processing compensation claims, preparing and procurement of contracts, and all that forms of payments. Like we've said earlier on, the IMS structure is adaptable and scalable. So each incident will be different depending on the location, the type, and potential impacts of the threat. And so the modular design of the IMS means that the structure can be adjusted by adjusting the size of the teams for each of the functions. And at the local level, where teams are smaller and demands are operational, a small public health emergency operations center of one or a few people might carry out multiple functions. In a larger response requiring coordination at the state or national level with multiple agencies, a larger public health emergency operations center may be used with correspondingly larger teams. So in summary, the incident management system or the incident command system is the system commonly used to manage all hazard responses. And there are 5 core functions in the IMS with various roles. These include incident management, operations, planning, logistics, and finance and administration. IMS is scalable, so it can be shaped to suit the requirements of the response. Thank you, and see you in Unit 4.